New tonight, a study by the American Academy of Pediatrics and the Children's Hospital Association shows more than 61,000 children in the United States were diagnosed with coronavirus last week. That's the largest number reported since the pandemic began 8 months ago. The study says children now make up about 11% of positive COVID-19 cases across the country. WAAY 31's Grace Campbell spoke with Hartselle City Schools head nurse about what she is seeing among children in her care.
Kelly Morton told me the district is seeing the number of positive cases increase again after a few weeks of it decrease. She credits part of the increase due to the infamous COVID fatigue.
I think people maybe got comfortable because it did seem to settle down a little bit, but that's where the vulnerability happened or can happen.
Hartselle City Schools isn't the only district seeing cases rise in North Alabama. Huntsville City Schools, Albertville, and Arab City Schools are just a few that are seeing the increase. Dr. Zora Caudry is an infectious disease specialist with Huntsville Hospital. She told me the increase of COVID-19 cases among youth could be from tests being easily accessible. Morton agrees and thinks another reason could be people trying to go back to pre-COVID days.
The rec leagues have gotten more up and going, including those younger kids. I don't know if that has anything to do with it, but I do think there's more activity. Again, it goes with that COVID fatigue and kind of loosening things up a little bit.
Symptoms of the common cold and stomach flu are common symptoms of COVID-19 in youth. If you're questioning yours or your child's health, Morton urges you to get tested.
Over and over we'll hear, oh, I thought it was just a sinus infection or it's just allergies. I don't think we can get away with that anymore. I think that you have to assume that it could be more until the doctor tells you otherwise.
In Hartselle, Grace Campbell, WAAY 31 News.
Health experts warn that we could see even more of an increase of coronavirus in children in the coming months.